Hello and welcome to Supervision Smörgåsbord, a podcast full of tips, tricks, and interviews with experts to help you enjoy being a supervisor. Here's your host, Dr. Tara Sanderson.
Hi, everybody, and welcome back. Thank you so much for joining me today. I have a new guest today. Today, we're going to be talking with Dr. Jess Hogan. Her pronouns are she, her. Dr. Jess Hogan is an ADHD licensed clinical psychologist in Minnesota and California, where she has a group practice that oversees neuroaffirming assessment training programs for doctoral students and postdoctoral fellows. With over a decade of experience conducting autism and ADHD assessments, she is now offering individual and group consultation services. Additionally, Dr. Hogan has taught assessment courses and clinical PsyD programs and serves as the principal investigator on a research project examining the experiences of autistic therapists. Her special interests include neuroaffirming care, true crime, reading, and circus arts, which is so cool, and I cannot wait to hear more about that. Welcome, Jess. Thank you so much for being here.
Yeah, thank you so much for having me, Tara.
Well, we always start our episodes with a guest question, and today's guest question is, what chore would you love to never do again?
Okay, so the chore that I would never want to have to do again is absolutely cooking. Cooking stresses me out so much. I know some people love to get creative with it, but for me, it just involves way too much executive functioning, like the planning piece, and then having to plan out multiple meals. And then when you actually cook, being autistic, when you follow the recipe to a T and then things aren't fully cooked, panic. Then it's what do you do? How do you... Yeah.
I followed the rules and it did not do what it was supposed to be doing. And I don't, now what do I do? Because there was no and if this happens, then I do this scenario. Yeah.
Exactly.
I feel that way about baking. I feel like baking has such finite rules of you put this first and then this first, and that's how it turns out fluffy. But if you put this first and then this, then it's completely messed up in some way. And I just I know that there's chemistry behind it. I didn't take chemistry in school, so I have no idea what that means, but I know that there is chemistry behind it. And it just, it stresses me out. I have a girlfriend who bakes to de-stress, and I'm like, how do you do that? I can't even fathom it.
Yeah, no, I would much rather go to a bakery and just pick out my favorite Danish and then be done with
100%. Yes. Yeah. And if other people prepared all of the food, then great. All I have to do is do that piece. That's wonderful. I like it a lot. I would totally love a live-in chef. I think that would be fantastic.
Yes, exactly. That would be perfect. So that's my dream.
Now the dream is out there. Let's manifest that for sure. Well, today we're going to be talking about supporting our autistic and ADHD supervisees. And as most people know on the show, I'm pretty casual at this, and I really just want it to be a conversation that we get to explore whatever's kind of big on your mind about that. So, I mean, it could be anything from a couple of tips for supervisors on what they can think of, or maybe just even kind of exploring some of the experience that you have noted. So we're going to let you take it away and let's get into it.
Yeah, sure. I mean, gosh, I was reflecting on this last night, thinking about how I love being kind of the supervisor that maybe in some ways I didn't get in a way. I remember just having so many supervisory and training experiences where, I mean, a lot of them were amazing, of course, but there were some aspects of who I was kind of expected to be or who I was trained to be that felt really inauthentic to who I am as an autistic and ADHD human. And I just feel I feel I just value the authenticity piece so much. And I think that really instilling in the supervisees, ways to kind of unlearn everything that they've learned so far in grad school. I literally remember them training us how to use all the active listening skills. So literally training us how to mask. It was okay, you can't, be too like stern in your face. You have to monitor and make sure that you're giving a neutral expression, and you need to be looking them right in the eyes the whole time. And you need to lean forward and be nodding and doing the mm-hms and being pretty still and almost like not blank slate, but kind of a blank slate. And I think that, and from what we know about autistic and ADHD humans and the effects and costs of masking, I think that that's having such an impact on our trainees today. Like, I see so much burnout, especially coming out of sites that they have to be like on all day like that. And they can't do things like be themselves in session, where maybe they have fidgets, or where they're allowed to move, or they have fluorescent lights and they're not allowed to have other lighting. I've known supervisees that will literally be instructed, like they have to make eye contact, like they can't move around in session, like they can't bring their fidgets in. And gosh, like it just, right now I'm just so passionate about spreading some ripples of change and awareness in that area about how, it's actually, to the supervisor's benefit when supporting neurodivergent supervisees to be supportive of that, because then they'll be less burnt out, they'll be more present for the clients, they'll be much more able to give good care to the clients, they won't have to take as much time off. Like, there's just so much like benefit to the supervisor, the practice, the clients, to the supervisees to really be supportive of that authenticity in the therapy room. And in the larger workplaces too.
Absolutely. I think that the piece that we are having to dismantle within our industry is the component of like, what does it mean for us to do this relationship well, right? And because if the when I think about the piece that I get from a lot of students of like, what is therapy? They're like, well, therapy is a relationship between the therapist and the clinician, right? And that we're utilizing that relationship to help the client with whatever it is, whether it is symptomology from a diagnosis to personal growth to whatever it is. Like, that's the game. Is we have this relationship that we're building on and utilizing to make change within the client's life in whatever way the client is hoping to see that change be made, which is awesome. And it's real hard to utilize the relationship if you can't show up as yourself in that room, right? Like, if what we're teaching them is like, I'm not really here, like I'm hiding behind this like very stoic little mask or whatever, then it's real hard to teach the client to be authentic in their relationships and to utilize that next space. I'm always thinking with my supervisees of like, what are we modeling from supervisor to supervisee, from supervisee to client, from client to relationships? What are we modeling in this space? And if we're modeling that my job is to sit here, I remember a supervisor telling me like to sit with my hands very open, right? I couldn't have a little like clipboard in front of me to take notes because I had to be very open. I had to not cross my legs. I had to be sitting in a certain way. And in my videos, I remember them telling me like, Tara, I saw you moved your foot up under your body again. You positioned your body in the wrong way to do therapy. And I'm like, how is this wrong? I don't understand. So this dismantling of I think the strictness, I think the rigidity of what it means to be a therapist in the room with our clients is like a really important factor, and not just for our neurodiverse clinicians. Like, this, I feel like, is for all of us in a way to say like, okay, if we're utilizing this relationship, then we have to be intentional about the choices we're making in how we are teaching our clients different things, or how we're navigating different, understandings of what they're going through. But we still have to kind of show up. And if we start showing up utilizing our own personal selves in a way that's not beneficial to our client, then we should take a look at like, what are we doing here? If we're doing stuff that is primarily just going to benefit me, or like when we're giving advice to our clients instead of asking them to like think of options or whatever, like there does come a point where we have to know where the line is. But most of the time that line isn't whether or not you're using a fidget in session, right? Or that you have, lamps instead of an overhead light. Like, those things aren't the things that are going to be the barrier in to whether or not the client is going to get something out of therapy.
Mm-hmm. Exactly. Yeah. And I mean, I think that yeah, like those things, like it's the reasonableness of them, like that gets me sometimes, like with my supervisees and what they tell me about, like maybe other sites they've been at, or and yeah, and under ADA, like we do need to give like reasonable accommodations, and sometimes, yeah, like they're denied those kinds of things, and it's just when there's no like reasoning behind it, like when you can't explain and it's more authoritarian, like, well, it's just because I said so, like, or this is just like how I was trained, and this is just how it is, like, then yeah, you're right. It is a little bit rigid, which is kind of funny because yeah, like especially like autistic people, like I feel like we're thought of as very rigid, like and oftentimes I find that it's these systems that are actually pretty rigid, and that's like the big thing that I tell other people wanting to be supervisors of neurodivergent supervisees is just like the flexibility, like just and listening to what they need and problem solving through that, and can we be reasonable on this, or like even if you have an initial reaction like, oh, that's not right, like maybe exploring that a little bit and seeing, especially if something's like a competing need of yours, even like maybe seeing if you can like bend a little bit and try something new, and that does come up sometimes, like I like the ADHD kind of part of me can take over sometimes, and I love chaos, and my schedule switches from week to week. And I think one common thing is like the scheduling issue. So I kind of like to be like, oh, text me next week and we'll set up a time. And a lot of supervisees, like they really want like that, like pretty stable time, like every single week. And so that's a competing need. I would rather go week by week and they wouldn't. And so, but I'm always going to bend a bit to their need and be like, okay, how can I accommodate that a little bit more? But yeah, there might be some communication differences. Like if I prefer to, text, but somebody else who really likes to meet to go over things verbally, like I'm gonna meet with them verbally, to go through those things. We can make a lot of things work. That yeah, yeah.
Yeah, I feel like when we're thinking about our role as supervisors, a lot, I mean, 99% of what we are doing is trying to train them to become the clinician they are going to become themselves, right? When we get stuck in the rigidness of we have to do it this way, I think that begs the question of like, why? Like, and I'm a rule follower. I love a good rule. Like, you tell me these are the rules, I'm going to
Mhm.
follow them. And like, it's really important for us to make sure that the reason why that's the rule is still a valid reason why it's the rule. Like, I mean, at our practice, all of our notes have to be done same day. But same day is not directly right after the session if that's not what works for you. As long as it's
Mhm.
getting done the same day as the session, I'm a happy camper. So I work with my supervisees on like, okay, during your first week, I want you to practice doing it right after the session and see how that feels for you. If you hate it, practice taking a half an hour after 3 sessions and writing all of them then. And if you hate that, then let's figure out like maybe it's you are somebody who blocks out an hour at the end of the day to do all of your notes all at one time. That could work fine too. Like, let's just figure out which way it works for you. It still needs to be done same day, like,
Mhm.
but how and where and how much time it takes for you to transition from this part of your brain to this part of your brain, we just need to find out what works for you. Because the rule is
Mhm.
here for a reason, because we need to bill insurance and we need to do these pieces. And that's like, here's why that rule exists. And what do we need to flex in here to make it doable for you? If my rule was it has to be done at the end of every session, I should have a really good reason why that exists, and not just because if you don't, like, I'm not sure that your notes are getting done, because that's not a good reason for a rule. Like, the reason for the rule is billing and it needs to be done at this stage and time. And kind of looking at all of those pieces, like even looking people in the eye as a general rule for how we show that we're actively listening. I don't know. Is there a way for us to do that a different thing? Is that a rule or is that a preference of the majority of society, which doesn't really make it a rule in that stage? So
Mhm.
what can we do and how can we talk to our clients about what are our options in that? Because I have several clients right now who absolutely, like, we just sit on the same side of the room and we chat and we don't look at each other directly across because they don't prefer that. And that does not bother me one bit. And our supervisees can be that same way, or being flexible in things like when I host online meetings, I tell everybody that they can turn off their camera if they don't feel like they are wanting to be seen in that moment, or if they want to like turn the whole thing, not off, but like minimize. That's what I'm thinking of. Minimize their whole screen so they're not getting distracted by everybody's faces, and they can just listen and hear what's going on and be able to participate in a way that like makes them that much more easier for them. There's no rule that says you have to be on camera the entire time while I'm talking to you. Like that may be a preference of mine because I'm an extrovert and I really like seeing everybody's faces. But like, that's not a real reason to do it this way. And really kind of teaching people, and coming back to that teacher role as supervisors, teaching people to think about what is it that works best for you and advocate for those pieces. And as supervisors, how is what you are helping them learn about helping them become the clinician that they need to be, not just learn how to follow the rules right? Because I mean, by the time they get through grad school, they know how to follow rules. They've had to follow them for 12 years plus, right? Like they know how to follow rules, but the question now becomes, how do we teach them how to do those things independently and do them well in the best way that works for them?
Mm-hmm. Yeah, absolutely. Yeah, you bring up such good points. Yeah, especially with like the notes thing, and finding, what works for you. And just, I think just as a supervisor, like being aware of some of, those common things that might differ with a neurodivergent supervisee. So like, for example, like they often like to chunk things. So like having maybe, if they're doing like, for example, my doctoral trainees, like maybe they do just assessments on one day, or maybe just therapy on another day, and then maybe like a big chunk for documentation. And sometimes that works really, really well. Knowing, for example, like a lot of our autistic folks, especially, might actually be more on the hyper empathy side of the spectrum of empathy. And so they might actually need a lot more time in between sessions to like decompress and like work through that. Like they really like deeply feel like everything that was just talked about in sessions. So they might need not just, 10 minutes in between sessions, but they might need like a half an hour or an hour, or maybe it's more spread out throughout the day, or they see weekend clients. And that's kind of how I prefer my weeks. I feel like I know a lot of clinicians that like to chunk things, but I'm more of like I don't want to work for, actively, seeing people for more than like 5 hours a day, and then I'll work on the weekends too. So it just might be like little tweaks to really help people work with the way that their brain needs to operate. And so, I love that you brought that up. The eye contact thing, especially, I think just giving clients a heads up about like some of those differences can be so helpful. Like just like I have one clinician who gives like a whole guide like to her before she starts with them, basically being like, okay, I'm usually like 5 to 10 minutes late for session. So if you want to show up at whatever 05, perfect. I will meet you there then. Maybe it's also disclosing like, okay, like, like I'm not going to be like looking directly at you the whole time. I'm going to be, coloring, and that's actually how I listen best to you. And I think that as long as we're kind of disclosing what to expect, or like addressing any like miscommunications as they come up, like I think it's wonderful that those differences have a place in the therapy realm. So and then and the like the developing independence thing, I think one thing that my supervisees can really struggle with in other settings, because they feel really misunderstood, is like that self-advocacy piece. And so that's one thing that I really try to promote with them, especially, is okay, like how do we get you to to set boundaries with us? And so we have like this questionnaire before they even start with us, where we ask about, okay, like here's some universal like and common accommodations that we provide for folks. Here's kind of some options that you have, like for flexible scheduling, or for doing like in-person versus virtual, or here's how to set up X, Y, and Z and supervision requirements or whatever. But we also ask, like, can we send you, like if like I work on the weekend, like, can I send you weekend emails? Or, and like, what are your boundaries? And really starting to get them to start thinking about that right away, and letting them know, like, we want to know when you're feeling burnt out. We want to know when you're drowning, so that we can save you. We can pull you up out of that. And I think that they can be kind of afraid to do that at other kinds of sites because they won't know if they're going to be supported in that way. So yeah, I love like teaching them how to know their own limits and to ask for what they need, and that it's normal to have brain differences and being able to do things in a different way and to have expectations. I really struggled with that for a long time as a supervisor trying to be neuroaffirming in supervision. I was like, okay, like this report was due, a week ago, or these notes, they're like 3 months behind on notes. Like, can I be firm? Is that okay? Like, as an affirming supervisor, is that asking too much? Is that being ableist? But what I've really learned, like kind of in community with other supervisors, is like we can have those expectations and we can help the supervisee figure out how to meet them in a way that works for them with a little bit of flexibility and grace at times. So yeah, so I love that you brought that up. Yeah.
Yeah. Your idea of having this, like, these are the accommodations that are regularly available to anybody, kind of a menu of options of things that are available, and then keeping that door open to, and what else might you need? And what else, what are things that you know about yourself from your own experiences thus far? And being able to kind of put that together as a kind of as an opener in your supervisory relationship, I feel like, and in them coming into your practice, I feel like is something that is so manageable for every single supervisor and every single practice out there. There is no reason why we can't come up with a Google Doc that is like, here are things that are options for you, whether it's simple things like, we do have lamps in every room. You're welcome to either use the overheads or the lamps in whatever fashion that you see fit, to like, asking about things. I ask for about things all the time of like, as you sit in different rooms in different chairs, because not all my chairs are the same in all of my offices, like as you sit in different ones, if there is a time when you realize like, ooh, this chair I totally need a pillow with, or like this chair is like not for me at all, let me know, because I can just like switch rooms that you're in, or we can get you a pillow, or you can, if you want to bring your own in because it's something that you really love, like those are things that we can do. But like that is a question I have when people get started. Another piece that we have that I can't change the actual location of things, right? Like one of my offices every room has windows except for one. And then my other office all of them have no windows except for one. So it's like opposite little rooms. And so I do have people where I'm like, okay, if your location is the room that has 0 windows, I can't always give you the window room, like, because other people would like the window room too. So like we all have to share that room that feels better to all of us. But what I can do is say, hey, if one of these rooms really gives you the ick in a way that like is more than one of the others, we don't have to put you in there. I can absolutely be flexible on some of those pieces, right? Because everybody has their own things. There's one chair at that office that is my absolute favorite chair to sit in. And if I could sit in that chair every day, all the time, I would. And the rest of them are like, they're okay, right? And we can be flexible on how we do those pieces. And I love this idea of taking a look at our offices, like the physical spaces, what we physically have at them, all the way through to things like, what are my timelines? Where is my biggest wiggle room that I can do on a psychological report that's due, or a note that's due? Where is my timeline on things like how much is too late for us to be sharing with our clients and disclosing that we're late people? I am a late person, much to my husband's chagrin. I always think I can do one more thing before I need to be in the next meeting or the next whatever. And so I do disclose that to my clinicians and to my clients as well, of like, hey, I'm pretty chronically late. And here's the moment in which you can call me out on it. Like when I am more than 10 minutes late, you can absolutely call me out on that. Up to that, I'm going to just tell you I disclosed early and this is just how we roll. And if that is a problem for you, I'm going to transfer you to another supervisor or to another clinician, because I can't change that for you. Like there are going to be times where I am absolutely on time, but I cannot guarantee that for my life. It's just not going to happen. And like trying to find where are our barriers, where's the flexibility, and then work with the supervisees who come in to like take a look at that menu of options and devise a plan together. And of course, ongoingly be flexible when the plan needs to adjust, because it always needs to adjust. We're never going to find the perfect thing. But that's such a doable solution to supporting our neurodiverse clinicians.
Right. And yeah, and I think frequent check-ins is really important in asking for feedback as well. And they might not know at first. Like so many of them, like when first filling out that form, they're like, "Oh, I've never been asked this before. I think it's this, but then I don't
Yeah.
know, ask me in a couple months and we'll see." And we can really promote them, like, yeah, getting to know themselves and who they are as a clinician.
Yeah.
And yeah, yeah. Um, I really loved what you said about like, yeah, like everybody can do this, like being able to kind of tell people, okay, like here's some universal things that we do to promote inclusivity here. Here's some common supports, and everybody just has access to them, whether or not like you need them. Like we have like HIPAA compliant AI to help with sessions or
Sure.
with notes or with report writing, as long as you're using it appropriately and ethically. But things like that where it's just there. And we even start in like the interview process being really upfront about like who we are as, like the clinical supervisors and the training program. And we really lay out like what we're looking for too. And we really encourage supervisees to, only come to us, if they feel it's going to be a good fit. Because so often in programs, I've heard that, they're supposed to accept every single interview offer and then accept the first offer that they get, to have that practicum or internship. And I think that is just ridiculous and terrible. And I think that, yeah, like it can just be setting them up for failure and for not getting those experiences that are going to be rich and really contribute to their training as a clinician. So yeah, I think just being as upfront as you can, like even from the get-go in the interview, and then just like throughout too. Like I'm learning that I am not as clear of a communicator, for example, as I thought that I was. And so that can be a little triggering for me sometimes, like when somebody's like, wait, like, okay, wait, did you mean this? Or like, actually, like, I'm not sure like what you're saying here. And then I'm like, oh my gosh, like, I thought I communicated this well, but that's a really common thing, especially with autistic supervisees, is just checking in. But I think just coming at it from the supervisory standpoint of like, okay, like, assuming positive intent, like I think that can often come off to people as, oh, like they're challenging me or they're challenging my authority or, they're being, they're having negative intent, and when really they're just asking for understanding and they want to make sure that they're doing a good job. And so things
Yeah.
like that, having those clear expectations and being open to like that open feedback process and dialogue and frequent check-ins for understanding as well.
Yeah. I love the idea of frequent check-ins, and especially from the perspective of like, of course, we're meeting with them every week, but it's so easy to get wrapped up in what is your caseload, what's going on, what are the risk issues? Like, talk to me about like the logistics of being a counselor instead of like also stepping back into that like bigger question. How are things going for you? And like what's working well and what's not working well, and making sure that we strategically put that into our work. One top tip I have for doing that, and I would love to hear if you have other options for tips for people, is I try and schedule some to do. Like I use Google. Google is my absolute everything in my workspace right now. So I schedule myself reminders for the day that I'm going to have that clinician come into my practice that I need to do a check-in. So it'll on my to-do list, it'll pop up and be like, hey, you need to check in with this person about this accommodation or this specific area, or this is your session where you're going to like zoom out, or whatever kind of note that I've written to myself. I have that pop up in my to-do list. I schedule emails to go out to them to say, hey, 2 weeks ago, we tried this new setting. How is that working for you? And I schedule those to go out when we meet to decide that thing. I say, hey, would you like for me to check in 2 weeks? And they're like, yeah, that would be great. I schedule that email right then to go out 2 weeks from now so that I don't have to remember that I was supposed to check in 2 weeks from now, because I'm not going to remember. I have way too many things on my plate to try and remember that too. So just scheduling those things to pop up in your world and draw your attention helps so much to make sure that you're keeping that check-in on the forefront with our supervisees.
Mm-hmm. And I love that. Yeah, you're like working with how that your brain works as well. And yeah, and I love having those conversations with supervisees, which does involve sometimes a lot of disclosure about, okay, like here's how my brain works and here's how you said your brain works, and let's work together to make this happen. And I think that's a really, really important thing about like supervising neurodivergent supervisees, is being really self-aware about how your own brain works, like your own communication style preferences, your own preferences and assumptions about how social interactions are going to look, and how much you uphold like neuronormative ways of being just in the workplace and in the supervisory relationship. And so I think that's like the first thing that I would tell somebody if they want to supervise a neurodivergent, supervisee, is okay, like how, yeah, like are you aware of your own neurotype and your own neurology and what all this is like for you? And then also like, then, okay, how up to date are you on, what autism and ADHD looks like? Because there has been such an explosion of understanding in the last several years, and we know now so much more than we used to know. And this is only now just trickling down into training programs. Like it's really not fully happening yet. But yeah. So are you up to date on all that? And do you feel well equipped to supervise a neurodivergent supervisee based on that? So
Yeah. And I think asking questions and being curious is such the important factor here, especially as we are again modeling for what they're going to do with their clients. Like they need to also be thinking of how their client's brain works, how they are interpreting their symptoms and diagnosis and all of those pieces, and what accommodations they might need to make, or what accommodations might need to show up in the space with their clients. So as we are mentoring that forward, we're hopefully going to see that translate into the work that we're doing with our clients, or with their clients in that way. How do you, transitioning just for a quick hot minute before we wrap up today, how do you notice that within the work of our postdoctoral residents and our students in the world of assessment, of like what kinds of accommodations might people need, or how does it impact differently when we're talking about assessment versus therapy?
Yeah, that's such a great question. And I think, again, it's a lot of similar stuff. Like we have kind of our stock, okay, here's kind of our assessment structure. And here's, like, okay, let's do, like, I prefer to do 2 hours for one session, once a week. And then that allows for a lot of insights to come up throughout the process. Like if they're like, oh, actually, I don't know if I mask, then they can think about it, do research, and then come back the next week with examples, and it can create like such a rich discussion and we can talk about it. So that's how I prefer to do it. But maybe somebody can't do all that like cognitive shifting, like from thing to thing, or can't do 4 assessment cases at once. Like maybe I want to, because I love chaos. Maybe they need to do one at a time. And it has to be, we're going to see you like basically the whole week, and then we're going to move on to a different client. So it's, again, just being flexible and allowing for some subtle shifts like that, and also allowing for a different style. Like everybody has a different style. Like with all of my assessors, like it's actually kind of like delightful. And that's why we love to rotate all of our new supervisees into like all the different supervisors and all the different people that have been there for a while, so they can see like, okay, like, yeah, we can do a visual feedback session, or we can do totally just, kind of improving it. And so I think just, allowing space for them to be kind of blossoming into their uniqueness as a clinician, while still, having the integrity and the rigor of the core assessment process. So
Yeah, I'm so glad that you said that, because I do feel like some assessment sites are so rigid. You have to produce this many people, you do this on Tuesdays and this on Thursdays, and like, because it's efficient. And I think that a lot of times, a lot of the rules that we create are based on efficiency, not based on like what's best, right? And I love the idea of you being able to work with them on like, yeah, I do assessments this way with, I may have 4 different assessees that I'm working with at a time, and I do these little 2-hour chunks on different things throughout the time, and then the report gets done by this point. So I'm meeting the guideline of what I need to do, but I do it this way. And somebody else is like one and done, and like it does it more succinctly. When I do assessments at my practice, I really only have like maybe 1 or 2 hour time blocks throughout my week. I don't have times really carved out for assessments. I just kind of take them ad hoc. So when I do them, it is like these little, like I will do multiple sessions over the course of several weeks where it's like, here's 1 hour here and then 2 hours here and 1 hour here. And my students all very much prefer right now anyway, like doing a 4 hour chunk with this client where we just dig in and do all of it at once. And like, then I can write my report and not have to do anything else. And they look at me doing mine and they're just like, how do you even function? Like, I don't get how you just like bounce between all the things. I'm like, well, my brain works different than yours. And this is the strategy that works for me to get these in. Because if I had to cancel a whole half a day for being able to do this thing, like that would throw me off in a whole different way for like the rest of my week. I don't know that I could like hold it together in the same way. So I think that being able to teach them, there are so many different ways to do this, and none of them are right and none of them are wrong. They are just what work for that clinician and for that, assessor. And you find what works for you that is efficient for you to do the work that you're doing, to do your best work, even if what's efficient for everybody isn't quite the same. So I love that. I think it's so helpful.
Yeah, absolutely. And then just an aside, like I also think that there's room for some differences in the amount of time spent and just stylistic ways of being with the clients too during the assessment process. So for example, I have one neurodivergent supervisee where she's the quickest in all things. So she does her sessions. It's like 2 sessions and she is done. And then her report is done the same day. It is boom, boom, boom. And then I have other people who they really need a lot of time to like be able to do the gathering, all the synthesizing. And so it takes a little bit longer. And,
Yes.
and I think that's okay. I think, we gotta not be super excessive, probably taking a year for an assessment is probably too much, but, but being flexible with, allowing them to not be freaking out about, okay, I have to fit this into a certain amount of sessions, giving a little bit of room where they can feel comfortable to, especially with our autistic supervisees, to really uncover every rock and nook and cranny to be like, okay, yeah, not this, okay, not this, and really feel confident in that. So that's just another thing
I
to
love
keep in
that.
mind. Yeah.
I love that. What a great tip too. Well, tell us a little bit about your autism assessment consultation group membership and the Divergent Clinician. Tell us a little bit about what's going on over there.
Yeah, absolutely. So I have a separate consulting business outside of my practice called the Divergent Clinician. So I'm happy to do consultation around doing affirming assessments, neuroaffirming care, supervising neurodivergent supervisees. I have a membership group right now. So we meet twice a month on Fridays from 12:30 to 1:30 Central, and we talk everything affirming autism assessment. So we've got a good mix of psychologists and master's level folks who are learning how to do assessments, and it is just so much fun. You get access to all of my resources, anything, any report examples that you want. We've got a private Facebook group, and then you get half off consultation services with me and report reviews. So that's really something I'm loving right now. And then hopefully I'm also creating a supervising neurodivergent supervisees course and a little like downloadable guide. So hopefully that'll be almost ready by the time this podcast comes out. So there's that as well. Yeah.
Wonderful. Well, yes, when that comes out, you let us know, even if it's not coinciding with the time that this goes out, we will absolutely drop that link on there anyway, because it is so important that people feel like they have the ability to build competency in this area. And I think that is the thing that I will leave people with today, is that when we're talking about becoming a supervisor who can do this work really well with our neurodivergent supervisees, it is another level of competency that we're building, and having resources like this course or a workbook or just spending the time learning more about what all of this means is part of our due diligence as supervisors and as clinicians to become competent in this area. So I'm so glad that you were here today, and I'm so grateful that you are out there doing the work that you're doing, and that so many people have had access to learning from you and from your other supervisors out there at your site. It's just amazing to know what is going on out there in the world. So thank you so much for being here with me today.
And thank you so much for having me, Tara. It's been such a blast talking with you.
Absolutely. All right, everybody. I hope you took some tasty morsels away today, and we'll see you next time.
This has been Supervision Smörgåsbord with Dr. Tara Sanderson. Please like and subscribe on your favorite podcast app. You can find us at drtarasanderson.com/podcast and on all social media at Dr. Tara Sanderson. Thank you, and we will see you next time.